Hi, I'm Ashley Ruza. I am a senior chemistry major at Fairmont State University, and I am currently enrolled in an honors course about consumerism and the environment. As a part of this course, we had a project to read a book relating a field that we're interested in to our course material. I'm going to be attending dental school in the fall, so I wanted to learn about how environmentalism is involved in healthcare. I chose to read Greening Healthcare: How Hospitals Can Heal the Planet by Kathy Gerwig. Kathy Gerwig is an environmental stewardship officer for Kaiser Permanente, which is a nationwide nonprofit healthcare organization that comprises of 39 hospitals and 700 medical offices. Gerwig's responsibility as the environmental stewardship officer is to develop, organize, and manage Kaiser Permanente's environmental initiatives, and she has been doing this for over 26 years, so she is very knowledgeable about sustainability and healthcare. Climate change has the potential to negatively impact public health. It is predicted that a warmer and wetter climate will decrease air quality and increase the spread of pathogens. According to the World Health Organization and the CDC, the public health effects of climate change are largely unaddressed. So individuals like Kathy Gerwig are putting a lot of effort into mitigating climate change by implementing more sustainable practices in healthcare. Kathy Gerwig has been involved in many projects at Kaiser Permanente, such as eliminating DEHP containing PVC tubing in their hospitals. For those of you that don't know, I didn't know before I read this book, DEHP is a toxic chemical found in PVC pretty commonly that is especially harmful to infants and children. So she worked on getting this eliminated completely in Kaiser Permanente hospitals. She has also been involved in energy conservation efforts such as easy projects like switching from incandescent light bulbs to LEDs. I think she called this low-hanging fruit in the book. Dimming the lights at night, which also allowed patients to rest better at night, and they had better satisfaction with their stay at the hospital because of dimming the lights, and it saved energy. She also worked on purchasing energy-efficient technologies like energy-efficient computers and printers, and printing double-sided. And then there are more costly endeavors like incorporating renewable energies such as wind and solar in hospitals. Gerwig has also been involved in the organization of a weekly farmers market that allows patients, employees, and community members to purchase fresh local produce. I thought that was really cool that there's a farmers market at a hospital weekly that the community can go to and support local businesses and local farmers. A lot of Gerwig's efforts at Kaiser Permanente have been in partnership with Healthcare Without Harm and Practice Green Health. Both are organizations focused on sustainable healthcare that will positively impact the environment and therefore positively impact public health. I really enjoyed this book, although it is not specifically related to dentistry, which I choose to obtain a career in. Many of the green initiatives could be incorporated in dental practices. Something I found particularly pertinent to dentistry was the reduction of blue sterilization wrap by replacing it with reusable sterilization containers. Every dentist office I've been to has an autoclave to sterilize equipment, and these blue wrap bags are used to encase the instruments for sterilizations, and it would be really easy to replace these blue wrap bags with sustainable reusable options. And although the reusable options would probably have a higher upfront cost, you wouldn't be having that consumable cost from having to purchase the blue wrap bags as often, and it would also reduce the waste. This book was a really quick and enriching read. Even if you're not in the healthcare field, it was really valuable to learn about how healthcare is impacting the environment and public health, and the initiatives that are currently going on to make that impact on the environment and public health a positive impact.